Okay, we have arrived at Chapter 20, Understanding the Impact of Data Analytics and Big Data. So this is really important to managers and administrators with the invention, if you will, of internet, the application of new technologies and building new ways to keep up with data, artificial intelligence, etc. It is a great progress, if you will, but with that comes a lot of responsibility and headaches at times. But anyway, page 233 in your book, the section defines data analytics and big data. So data analytics is very important, and especially related to healthcare. So what is big data? It's looking at numbers and stats. Again, managers and administrators, their main focus in healthcare is compiling more data with the electronic health record, electronic medical record, whatever you call it, at the facility you work at. It's just so much is at our fingertips now with the ability to run these numbers and keep this data recorded, stored, etc. So big data typically refers to the volume of data so large that traditional health information technologies can't manage it. They can't take care of it. When I first started as a nurse, we used to document on paper and keep up with charts. And that was fine when you had 100 patients, just as an example. But when you suddenly have 1,000, where do you keep that paper? Where do you keep those charts? Where do you keep that information? Who is actually going back and reviewing the information to collect data? So there's a significant difference, and that's probably, those numbers are not realistic. So let's go with comparison of 100,000 patients in a month compared to 1 million patients in a month. So then that makes it more realistic when you see the big data. Page 234, it goes into the kilobyte, gigabyte, terabyte, what's the other one, petabyte, as far as how big data is measured. And if most of us have cell phones. If you've ever had to buy a new cell phone because you ran out of data, or your cell phone itself was running out of space, go look at the differences in your files as far as small, medium, and large files, what you have on your phone. So that's just an example. Okay, let me focus. Page 234 at the very bottom. What is big data in the healthcare industry? It is how physicians send prescriptions to pharmacies, how they write notes, how they order x-rays today. It is how we store patients' medical information, their billing information. It's all about pharmacy data, even social media. The hospital I work for has a social media account. That is big data. Because you're somebody, when a post is made on social media, somebody's going back and reviewing how many likes, was it shared, and maybe not somebody, and there's an application somewhere in the big data world that is keeping up with that information. All right, page 235, two basics approach to data. There's a retrospective and predictive, and then there's prospective, which is a subset of predictive. So I'm not going to read this to you, but retrospective is basically, why did this happen? How did we end up here, whether here is good and positive or whether here is bad or negative. The predictive analytics approach is guess based off of what we already know. And then, like I said, the perspective is just a subset of the predictive. Okay, page 236. Data analytics and healthcare analytics serve many purposes. So with our patient population, they become customers, and even in the human resource department, employees are also customers to a certain extent, depending on the company. It basically comes down to making people happy, quality service, great outcomes, and we don't want to lose anybody. Page 237, data mining. And this chapter for me was a good overview, or well written, I guess I should say. If anybody struggles with this information, please contact me. I can go into it a little bit further if I need to. The PowerPoint is also short and sweet for this chapter. Data mining is big data in this revolution that we're in. Again, this is the first time, or maybe not the first time, but within this decade, this is new to us, having access to this type of information and having the ability to store it, run numbers, etc. So how is data mining used? It goes back, basically, this talks about software applications, etc. But we're building relationships with people. When we have more information, we do better. We should do better. When we know better, we should do better. So with this information at our fingertips, we can make improvements in building relationships with our customers, because ultimately we want to make more money and serve the community well. And then new protocols come out of these type of dating mining, the data information that we get. How do we make things better? Page 238, you can read that. Challenges on page 239 in conclusion. So this paragraph speaks of, like I said, it's a privilege to have this information at hand, but we have to relearn and reteach, retrain, as mentioned in this paragraph, what to do with this information. Okay, so now we have it. How are we going to apply it? And it talks about large companies, AT&T, Amazon, Google, retraining folks and people spending a significant amount of time in learning how to manage this data and what to do with it. Then lastly, the chapter mentions progress versus privacy. So great, we have this ability, but where do we draw the line at keeping people's private information private, and what can be shared, what should be shared, etc. So please let me know if you have any questions.